Welcome back to Daybreak, everyone. It is Tuesday, October 15th, which you might be surprised to learn is Global Handwashing Day. It's a day dedicated to global advocacy aimed at increasing awareness and understanding about the importance of hand washing with soap as an effective and affordable way to prevent disease and save lives. And joining us now with more on this is John Scallon, the Director of Quality for St. Peter's Health. John, good morning.
Good morning.
Thanks so much for being here. So tell us a little bit about, why do we need a day to talk about hand washing? I'm hoping that this is something that everyone's doing, but maybe not.
Well, it's extremely important to hand wash in terms of preventing the spread of disease. Since 1846, it's been known that hand washing is a very effective preventive measure. During the Crimean War in 1850, Florence Nightingale really championed the cause, but it wasn't until the 1980s where it really started to take hold as a standard practice.
And have we seen it change over time? Like, what is the correct way to be doing this?
Absolutely, there is a correct way to wash your hands, and a lot of people don't realize that it takes about 20 seconds of lathering, rubbing, and making sure that that soap gets really in there between the fingers and the fingernails, and then rinsing off until completely all the soap's off.
And then hot water, cold water, does it matter?
It really doesn't. You just need water, you need soap to really have it be effective.
And now you see hand sanitizer around a lot. Is that just as good, or is soap and water still better?
Really, it's hard to beat soap and water. Hand sanitizer is a very good preventive measure, but there's a lot of pathogens, a lot of contaminants that soap and water just can't, there's no replacing soap and water. Norovirus, winter vomiting disease, as an example. C. diff, explosive diarrhea, some of the more unpleasant things. Really, there is no substitute for soap and water.
And so I read a study that said 60% of high school students say they always wash their hands after the bathroom. Only 60%, so there's presumably another portion that's not. How do we up this number and get everyone to be doing this?
We really just have to reinforce the importance of washing hands. Having those soap dispensers always give you the soap, making sure that an organization like a Walmart or a grocery store is really on point to keeping those things stocked up. And people also have to develop that awareness themselves and not be afraid to ask people providing services to them, providing care, to wash their hands. If you're seeing your doctor, if you're going to the restaurant, you're getting food served to you, people really need to feel comfortable speaking up for themselves and insisting, I really am going to have to ask you to wash your hands, please.
Are there any other unusual times, like we usually think after the bathroom or when food is involved, but are there other times we may not think of that we should be washing our hands?
Absolutely. Whenever we touch high-touch areas, we call them high-touch areas because a lot of hands are on there. It's used frequently. Things like keyboards, door handles. Something that a lot of people don't think about is a cell phone. When you really think about the amount of high-touch areas your hands are encountering, and then you're touching your cell phone, it's surprisingly contaminated.
Surprisingly, yeah, exactly. All right, well, John, thanks so much for talking to us this morning. A lot of good information to get out there. Appreciate it.
Pleasure.
All right, I feel like I should go wash my hands now. We'll do that in a little bit. We got to get to some weather. Andy Curtis is going to tell us what's going on outside.
Yeah, thanks, Jake.